We have a lot of resources for you, but I really hope that the information we've provided so far helps you think about the program in your facility, what you can do to help to prevent violence, and help your committees and co-workers and employer. Now, what can you do at that nursing level? We're just going to go briefly through give you some ideas and some tips, not all inclusive again. But the first thing is obviously know your facility's policy and prevention around workplace violence prevention, control, response, de-escalation techniques, reporting procedures. Maintain that situational awareness. That's very hard to do at the end of a 12-hour shift when you're short-staffed and tired. I'm going to talk about taking a buddy with you in a second when you're providing patient care. But know where your panic and duress alarms are, your emergency telephones. This is very important if you're in float pool, for example. Maybe you go to a new unit you haven't worked on before, or you're traveling staff and maybe orientation didn't cover this very well or you've forgotten. Make sure you know how to get help at the start of your shift. If you've got a personal alarm, make sure it's working every time you use it. And then if you're working alone, especially with a patient that may have a history of verbal or physical aggression, or their family members do, communicate your location to your co-workers. And if necessary, you may have to ask for someone to work with you if you're concerned. In any case, make sure you have an exit plan and don't get yourself trapped in that patient room. If you know your patient has been verbally aggressive and you think, hey, they didn't mean it, make sure you communicate this at shift change. And I'll give you a story in a second of why. Beware of equipment. No surprise there, that can be used as weapons. Stethoscopes are an obvious one. I still see them. There's an infection control issue here, but that's not the topic we're getting into. Lanyards for badges. I still see the breakaway badges, but the lanyard is left and could be used to strangle you. Avoid those threatening situations. If you're in an elevator or stairwell, parking area, and the light is poor or the light bulb's not working, make sure you report that to the appropriate people like facilities maintenance or safety. If you have security and you're worried about walking to your car at night, then ask them to see if they can walk you to your vehicle. Use that buddy system. Now, in some state laws, such as Oregon, if you're a home health worker and you're worried about your safety when you go to see a patient in their home, you can ask under the law for someone to go with you. So find out about your state law and talk to your supervisor if you're concerned about having a second person in that room. And then know your state laws about refusing to provide care. And, that's the licensing law. I know that's very tricky. But be aware of what you can and can't do. And certainly, if you are concerned, speak up and get help. So this is the ANA position statement when it comes to speaking up about your safety and patient safety. So I'm not going to read that to you, but we have a professional obligation to do that. And then there is a rule around the right to refuse dangerous work under OSHA. And there's a link for you there if you want to go and find out more. Check for violence alert, signage on patient room doors, indicators on the patient chart. Make sure you conduct that risk assessment if you have one in your facility. But in any case, make sure you communicate any concerns for verbal or physical violence by patients or family members. And this goes without saying, this applies to your co-workers as well. We're focusing on patient violence, but you need to report that co-worker violence too. And sometimes that's hard to do to your supervisor, and we're going to give you a list of resources and where to get help in a minute. I'm going to tell you a story about a CNA who was helping a 6'4", 280-pound patient with mild Alzheimer's from bed to bathroom. She got him up with his walker, and as he went towards the bathroom, he went to fall. And of course, as we do as good healthcare workers, we try to prevent the fall, even though we usually get hurt doing that. As he fell and she tried to catch him, he punched her in the throat. And then as she caught him, she herniated L4, L5 discs in her lower back. Now, the disc herniation is cumulative from manual lifting of patients over time. But when I talked to her, she was more traumatized about being hit in the throat. And what traumatized her more is that the staff on the previous shift knew that this patient had been verbally aggressive, and no one communicated it as shift change, put a note in the chart, and certainly didn't tell the CNA. So very sad to hear that. She's since now left healthcare because she's disabled. Obviously inform your supervisor or manager of any situation or risk for custodial disputes, domestic violence. When it comes to trauma-informed care, that's a big topic right now, understanding past trauma and how it impacts that risk of violence with your patients and why they're aggressive and violent. But I want to make sure you know this applies to you as healthcare workers as well. And I want to just tell you a quick story. This nurse told us she almost left her unit, hospital, and career after a shift in the ICU 5 years ago. She came to work early to help out, and her patient assignment was a one-to-one suicide precaution. The patient had overdosed, was intubated, and sedated for several days. When she got to work, he'd just been extubated and was furious that he was still alive. He took his anger out on the nurse with his words. First of all, he started off mean, and then it quickly turned to sexually explicit violence. He was perverted, obscene, and aggressive. And the nurse told him repeatedly not to talk to her that way. She's a professional. He continued. She called security and was told it's part of your job, suck it up. She notified her clinical coordinator, who relieved her for 5 minutes so she could collect her thoughts to cry and pray and call her husband. She couldn't switch up assignment. She had 4 hours left on the shift. The patient's words set a trigger off for her because she was a survivor of childhood abuse. And it took her back to being a scared 4-year-old little girl. She came to work the next day, and fortunately for her, she talked to her director of nursing. And because of what happened and because she spoke up, this facility now has a workplace violence task force, procedures, policy, training, and they meet monthly and are very proactive at addressing violence, including sexual assault. So I just wanted to bring that point home because, as I said earlier, we don't talk about sexual assault and abuse. And it's a problem, and we need to speak up and start addressing it. What else can you do? Check your coworkers know your policy and prevention, your violence policy and prevention procedures, and so on, and response procedures. Think about all your temporary staff, your students, your volunteers. They need to be kept safe as well. Make sure that information in your patient's chart is up to date, not just for providers internally, but for providers in the community when the patient's discharged. They have a history of violence, and you may want to be communicating that to them. And something I didn't mention earlier, we like to flag a patient's chart for history of violence, but we actually don't know if you have a history of violence, that's a real indicator that you're going to be violent again in the future. So we want to do that. It's one of the indicators, but don't rest your hat on that one. We have to look at physical, overt behavioral signs in that moment in time when we're caring for our patients. Participate in training, follow your policy procedures, and speak up if you don't think policies and procedures are working or the training is ineffective. That's very important. If you're involved with violence, try to de-escalate the situation. If not, just get out of that situation and save yourself first. I know as nurses, we don't want to do that typically, but you need to get out. Sometimes we just have to leave, exit, and get help because it's the safest thing to do for you. Immediately report any types of violence, intentional or not, verbal or physical. Notify your supervisor, and more importantly, seek medical care or first aid if you're injured immediately. And then, follow your reporting process. And then it's nice to have a code word, a protocol in place that if you're de-escalating a patient, you might actually not be successful and you might escalate the situation. Can your coworkers come in and say, Linda, Dr. Armstrong needs to see you now. And that's your code word to get out of that situation and let your coworkers take over. So, build in that code word. I have seen staff tap other staff on the shoulder. I think that can be a little scary sometimes. So I would have a code word is my advice. Participate in post-incident briefings, support your coworkers as well. Use your EAP resources and counseling programs. They may be paid for by the employer, but they are confidential. Do use them. And as I said, support everybody that's been involved in an incident of violence, whether it's patient violence or bullying. If you need to file criminal charges, make sure you know your state law. It's quite daunting to do that as a nurse because it's often the individual that has to file charges. The hospital can't do that. But in a lot of cases, when you talk to your employer, they want to support you. So it's worth talking to human resources and see if they are going to support you in filing those charges, because that can help allay some of the stress. And then we just have a couple of slides to finish up with here. These are your resources to find out more information. So there's previous slides to hopefully or helpful tips for you. Where do you find out more information about your workplace violence program in your facility? It could be human resources, employee health, your workplace violence committee. Hopefully you have one. If not, maybe you can start one. Your security manager, your labor representative, and certainly if you have a behavioral health department, they can be a great resource. So do reach out and get help. You're not alone in this. And the more we speak up as nurses, we're in a powerful position to really make an impact on this serious issue.